So when it comes to physiotherapy, what's the difference between manual therapy forms of more full touch, a lighter touch approach, and the more hands-off approach to physiotherapy, which is so often what's provided by the National Health Service right now? So my original training was very much in approaches towards spinal and peripheral joint manipulation, very similar to osteopathic approaches. My own training has gone down the road of working alongside osteopaths, using more osteopathic approaches, muscle energy techniques, wonderful, wonderful techniques. So many of these are being lost now in the training of young physiotherapists to the favour of hands-off, distance, keep the patients at a distance, purely exercise approaches. Not saying exercise is important, it's often an adjunct, and very often we have to try to get the patient's engagement with their own work. That is important. Towards a lighter touch though, my journey has taken me towards understanding less can be more. And sometimes, like people, if we try to push them around, we meet resistance, yeah? And I think the tissues are the same. There are lighter touch approaches, myofascial release. Well, that can have a more direct form, what I call direct myofascial release, but an indirect fascial approach, and some of the training I've done, this overlaps a lot more with, say, craniosacral approaches, where it might be that we make contact with the tissues very gently and we wait for some softening and yielding and unwinding of the tissues where there's a greater relationship between the patient. And I think that relationship yields better results. And I think the other thing about lighter touch is it's wonderful when we start to work more holistically with the body, because we're not just working on a local muscle and thinking it operates in isolation or one part of the spine or a joint. We're seeing, yes, okay, well, maybe there's a relationship through to other structures in the body. It's like a spider's web. If there's a tension as a fly flies into the web, then the whole web changes. And the spider can feel that. Well, if with a therapist with our hands skilled to feel where have the tensions in the body gone, then we can really start to see the body as a system and not just put fires out by working on one local thing. An exercise hands-off approach can be really powerful. It's often oversimplified these days to strength. There is a big professional emphasis on strength training, and don't get me wrong, that's important. There is evidence to suggest that strength training reduces the incidence of Alzheimer's potentially. It's very early research, but there is some suggestion of that. Exercise is a powerful thing. It does lots for our well-being. We know that, for our mind and for our body. But in terms of how it helps us heal from chronic illness, there's much more than just strength training. There is flexibility training. There are different forms of movement therapy. There can be myofascial unwinding techniques. Now, I know that these are techniques that I use, but I'm sadly also aware that they're not embraced within the National Health Service too often. That's a very traditional approach to strength training, and some flexibility training. So a hands-off approach has a role. And I think we could expand that role as a profession into other forms, encompassing martial arts, Tai Chi, Qigong, yoga. And I think that works very well as an adjunct to manual therapy, but I don't think it's ever a substitute for good forms of light touch and more full touch manual therapy. Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. And don't forget to hit the like and subscribe buttons.